So what do we need to know for PLAB 1 exam? I have some key terms here, like what does it mean by bacteriuria, urethritis? These are things that we should already know. So what is the common cause of UTI? It's E. coli. Everyone knows that. Now, this is not a big thing they ask really about. What they really ask about is investigation and management. Before I go to that, risk factors, I just want to stress on a few things here. A person who had a recent instrumentation and catheterization. That's very important. Why is it important? Because they ask about patients who are catheterized. What do you do with regards to investigation? Okay, right. So moving on to pregnancy is another risk factor. Why is it important? I'm saying this is because they ask you about how do you manage, what do you give antibiotic wise to a patient who is pregnant. It's not the normal ones. You can't give normal medication. It's not 3 days like men. It's different. So we need to know the guidelines. Which guidelines? Nice guidelines, what they say how to manage a pregnant lady with regards to UTI. Okay, presentation. We have here Homer Simpson. What is it saying? High DUF. So what does it stand for? High DUF. H for hematuria, I for incontinence, D for dysuria, U for urgency, and F for frequency. So high DUF. Bear in mind, you can get a foul smelling urine or a cloudy urine as well. Okay. Elderly patients. Now, elderly men and women who have a underlying cognitive impairment, in the exam they may not say that, oh, the person has urgency or they have dysuria. They can say they have an acute confusional state. That should be enough for us to think about. We need to rule out UTI in this patient. Key factor here, don't forget this one. Okay, so we're going to move on to our few things about pains. If the pain can be on the costovertebral angle. Now, if it's in the costovertebral angle, then the diagnosis will not be UTI. It's going to be pyelonephritis, and we'll cover that in the next topic. How do you manage pyelonephritis? And these patients should have also fever as well. Okay, so if there is no costovertebral angle, then the management is going to be for this video. If they have a pain there in the exam, go toward the route of pyelonephritis. With UTI, you can get suprapubic tenderness. Investigation. Right, we all have seen this in our clinic or in the hospital when we have worked, a urine dipstick analysis. What do we need to know for PLAB exam? I want to zoom in into this box here, exam tip. This dipstick should not, let me circle that word, so in case we don't understand the word not, should not be used to diagnose UTI in 2 groups of patients. I already mentioned one of them, catheterized women and those above the age of 65. We don't use a urine dipstick to diagnose. Moving on, next one would we have midstream urine. This should always be taken before, look at the red box here, before giving antibiotics. To whom? To men and pregnant women. Mark these words, men and pregnant women. Okay, make a note of this. Okay, so let's go to management, guys. So very simple. Generally, men will get 7 days because it's not common, and men should not be getting UTI. Okay, it's not that. So they have a 7 days course, and women is a 3 days course. So men 3 days, 7 days course of what? It's up to you. Trimethoprim or nitrofurantoin. Okay, with nitrofurantoin, one thing you need to worry about. Let's see where we put it here. Should be right at the bottom here, if I'm not mistaken. There we go. Here, nitrofurantoin. I made a note here. Don't give it to a patient with the eGFR less than 45. Make a note of that, guys. Nitrofurantoin, eGFR less than 45. There's 2 things we need to know about this medication. One of them is about the eGFR. So back to men. If they have UTI, 7 days, full on trimethoprim or nitrofurantoin. Up to you. Doesn't matter. Women, 3 days, much less course. Again, doesn't matter. Trimethoprim, nitrofurantoin. It's your choice. Doesn't matter. If they're pregnant, everything changes, guys. Everything changes. What happens is that the course changes. Even though they are ladies, they are women, it's not 3 days anymore. It's going to be 7 days. We treat it like men. It's 7 days, not 3 days. Now, what do we give? Unfortunately, we need to memorize this nice guideline step. First choice, second choice, and so on. First choice is going to be nitrofurantoin. But making sure, look in the red, making sure that the lady, that woman, is not in term pregnancy. She is not in her 3rd trimester. Why? Because it causes neonatal hemolysis. So 2 things to mention about nitrofurantoin. You don't give it to patients eGFR less than 45, and you don't give it to pregnant women in their 3rd trimester. Second choice, cefalexin. Always cefalexin, second choice. Now, in the exam, don't choose amoxicillin. Okay, choose cefalexin, not amoxicillin. Amoxicillin is known that is known to be resistant, meaning the bacteria are known to be resistant to amoxicillin. They are not sensitive to amoxicillin. That's why we don't give amoxicillin as second choice. But when can you give it? Only give it as a second choice when the culture of the urine is back and it shows you that the bacteria will die from the amoxicillin, meaning the bacteria is not resistant to amoxicillin. Then, only then, do you take amoxicillin. So memorize this, guys. Our pregnancy, what to give first and second line. Now, one thing to understand, I'm sure we all know, trimethoprim is an antifolate, so we can't give it in pregnancy. Regardless, 1st, 2nd, 3rd, I don't care. Doesn't matter where. Don't give it. The most harm is caused in 1st semester. So because it's antifolate. Right. So I hope that was useful, and I will see you guys in the next video.